blood pressure remain high despite all that you've tried? That's exactly what we're going to talk about today. Because perhaps you've tried a whole lot, from concoctions to herbal supplements to foot pads to um, drinks to everything, to trying to lose weight, to trying to, just name it. I don't know what you've tried, right? But your BP continues to remain high. We're going to look at exactly what's going on with you, because this is a big problem that many people face all the time, and maybe you're currently facing. We're going to look at two aspects to this big problem, because it's a question that we get asked all the time. Meanwhile, if you're just joining, make sure that you like, you share, that you subscribe. Okay. My name is Pharmacist Chibwamam Ilechukwu, founder of Hypertension Africa, where we help you to wake up to normal numbers every single day, so you don't have to live on drugs for the rest of your life or endure all those adverse effects, and so you can have your best life in super health. So today we're looking at high BP. Why is this so difficult for you as a person to control? And maybe you've been trying to do this for several years. We're going to look at this from the angle of two different areas. We're going to talk about it in terms of the disease itself, and then we're going to talk about it from the angle of you as a person, where you're getting it wrong. And then we're going to talk about what should be your best strategy if you want to really enjoy high BP freedom and, enjoy your best life in super health. So, sometime last week, I put out a poll and I asked people, what does high BP freedom mean to you? I actually asked this on 8 different communities that I belong to, of high BP, and many people shared so many things. So, maybe for you, freedom means you don't have to swallow drugs every day. Freedom could mean enough of the headaches, just like we talked about last Whole and Wellness show, episode 30. This is episode 32. We talked about this on 31. Maybe it's freedom from headaches. Maybe it's freedom from erectile dysfunction. Maybe it's peace of mind, freedom from fear and anxiety. And I totally understand this. High BP can be very, very problematic if you don't know what to do, right? So why is it so hard for you despite all you've tried? And you feel like, yes, you've done your best, you're doing your best, but it just isn't going away. The number one reason is because of the disease. Drop disease in the comments. So the thing about the disease is what makes it hard for you and for many people. Now, high blood pressure or hypertension is a chronic disease. It's a chronic disease, and at the same time, it's a degenerative disease. I'm not trying to scare you. I'm not trying to make you feel like, wow, it's all over. But I'm trying to put things in perspective for you, so you understand what is happening within your body, and I'm trying to empower you. That's what we do at Hypertension Africa. Empower you sufficiently so that you can actually break the bond, break the cycle, and enjoy your best life in super health. High blood pressure itself is chronic. What this means is there's so many cases, or periods where people feel like, oh, the doctor gave me drugs. I've taken my drugs for the past 30 days. Oh, my BP has calmed down, it has normalized, and then you stop taking, and I feel okay now, and you stop taking the drugs. You forget that the high blood pressure itself is chronic, meaning it's not like malaria that you treat for 3 days and then you throw away your drugs. What it simply means is your body is not able to control your BP by itself. So with your body, you're getting something above 140 over 90, right? Now your goal is to make sure that you get it always less than 140 over 90. But if your body is not able to do that, and it doesn't stop, it doesn't stop, um, your body is not able to control that, then there's a problem. And so, yes, when you take your drugs, it would work for that period, right? So for that instant when you're taking your drugs, it's working. But the moment you stop taking your drugs, it doesn't mean your body has corrected itself. That's what we mean by chronic. So it's always there. That's the nature of the disease. It's also degenerative, which means that over time it gets worse. That is why maybe year one you were diagnosed, you were only on one drug, year two, one drug. But over time, you notice that the one drug is not working. And then you start to add different things, right? You start to try different, or even your doctor now says, oh, let's change to this one. Let's add this drug. When it's high, take this one. that is a symbol to you that it is degenerative, meaning it's getting worse, right? So that's it. That's why it's difficult. Okay, that's why your BP continues to remain high because on its own, it's chronic and it's degenerative. Now let's look at the second aspect. Okay, the second aspect. Thank you. Who's there? Oh, Mr. Augustine. Thank you. Good to see you. How are you doing? And how is Spain? It's really watching your presentation once in a while. Thank you very much. Okay, so let's look at the second aspect. The second aspect of why the difficulty apart from is about you. So what is it about you? Number one, you probably have never set it as a goal, like I'm going to crush this high BP within the next 90 days or within a 30 days. And I'm going to explain. Now, most people, like this is not public knowledge, right? For most people, you don't ever think it's possible, so you just live with it. You're managing it. And so that is the reason why it doesn't go away, right? So, but what if you can start to say, okay, I'm done with this and I'm going to do whatever it takes? Now, that's number one, right? You have not faced it as a goal. Number two, you are not using a strategy. Okay. Now, this is very, very important because when we say that I've tried everything, you're probably just doing a little bit of this, a little bit of that. Oh, you take so today someone sent me an advert that they saw online on Facebook. Someone was advertising food sold, something like food packs that once you wear it, it's gonna make the BP go away. And he's asking me, does it work? And I'm like, yes, it will massage your feet, it will release your stress, but would it reverse the high blood pressure? He's my client. So I said, with what you know now, do you think it would reverse your high blood pressure? Now that's the problem because there's a whole lot, everyone is pulling you from here. They tell you, take this concoction, take this route, take this. That is not a strategy. If all you're doing is, let me try this one today, let me skip tomorrow, some people, you start to starve yourself. You're not even eating just because of high BP. It doesn't work that way. So lack of using a strategy is why it remains high despite all you've tried. Now, so you're probably going to ask me, so what do I do instead? Now, let me tell you what you should do instead. Your goal, you can write this down. Your goal is to stop it from getting worse and then reverse it. Remember, the number one reason we said is um, the disease itself is chronic and degenerative. So it's always going to be there if you don't do anything about it. As we wind up the year, as we round out, as the year winds up, this is a time for you to say, you know what, as I step into the new year, I want to stop this thing from getting worse and I want to reverse it. What reversing it simply means that your body, you have to stop it from getting worse and then push it back. So you're gonna have to find a way to stop it from getting degenerative, from getting worse. If your body can control it, like back to when you were 15, when you were always getting 140 over 120 over 80. If you can get back to that original state, that is your goal as you step into the new year. And in order to do this, you have to work your whole system. It's your whole body. Before I jumped on this call, we have a client that we worked with for 3 months, and she's at a point where her BP is 108 over 70 something, and she has dropped virtually all her drugs. She only takes 2.5 milligrams of a drug. What do you think happened? She reversed it. Now you need a strategy to be able to reverse high BP. For you to be able to reverse high BP, you have to work from your mind to your body to everything within you. That is why we always say use a method, use a strategy. Yes, your food is involved. Yes, you exercise, but it's all based on your lifestyle, right? So drugs alone, if you've taken drugs for 5 years, 10 years, you would already realize that even your best drug can only work maximum 24 hours. At the end of the 24 hours, you need another set of drugs to continue the work where it stopped. It's not healing you from the inside, but you've got to use your lifestyle to heal you from the inside and push the BP back. That's the only way that you'll be able to get your BP under normal readings every single day and get off your medications. Now, how do I help you beyond this point? But I hope that this conversation is helping you to think differently. Like, okay, as I step into the new year, I'm ready to become free. Let me know in the comments if this resonates with you. Like, I'm ready to become free. I'm ready to work my body from the inside out. High BP cannot disappear on its own without you pushing it back from the inside out. It doesn't work that way. If you've had it for so long, you already know that it will not disappear on its own, right? So, how do you do this? We have what we call a high BP reversal method, which teaches you the three phases. You've got to work from your mind liberation to your body liberation, and then you activate your freedom. That's the only way that you're going to be able to get off your medications, and your doctor's going to look at your numbers and say you don't need these drugs anymore. I hope that I'm speaking to you. So basically, what do I want you to take out of this? Number one, what I want you to take out of this is, since everything you've tried has not worked, right? Isn't this time for you to say, okay, so I want to use something that works? And the only thing that works is working your body from the inside out. And that is the high BP reversal method. That is the only way out. Okay. To help you with this, we've got a webinar that explains exactly how the high BP reversal method works. It goes in depth into what the mind liberation, what the body liberation, what the freedom activation is. I'll link it for you below this video if this totally resonates with you, so that you can go see that webinar. That's where we explain it. Also, if you would love to say, countdown, I want to be free in the next 3 months. Trust me, we say 3 months because 3 months is more than sufficient time for you to really work your body back to repair. Right? If you would love like the hand holding, someone really reviewing what you're doing, making sure that you're using the high BP reversal method every step of the way to get your freedom back. You're also gonna be able to get the chance to book a session with me if you register for that webinar. Like after the webinar, you'll be able to book a session to have a conversation with me. I'll just drop my calendar, or you can send me a private message. Let's have a conversation about you as we step into the new year, right? So I hope that this helps you. Those are the two ways that I can help you beyond this point. But as a recap, thank you for joining. Don't forget to share this, to like it, to subscribe to our channel. If you're seeing this on YouTube, make sure that you subscribe to our channel. Um, so as a recap, we'd say, why has your BP remained high despite all you've tried? We said number one, it is because of the disease. On its own, high BP is chronic and it's degenerative, meaning it only gets worse except you stop it. And you cannot stop it by not making a decision. Like if you're listening to me now and you're like, I want to stop it, that is how you start to stop it. You have to make that conscious decision and then commit to it, right? And then we said the second reason it's difficult to handle is because of you as a person. You haven't said enough is enough. One of the things we teach members within our community is you've got to say enough is enough. And also, as you're watching me today, you've got to say enough is enough. Even if you've had it for 7 years, right? You've got to wake up one day and say, enough is enough. I have to push this back. Now, when you say enough is enough, the next thing is you've got to use a strategy. You can't just say, oh, let me go and buy more supplements. Don't make that mistake. A supplement would only work while you're using it. The moment you stop using your supplement, the BP comes back, which means the only way you can really, really get your body back and stop taking medications is to get your body to control the BP by itself. In order to do this, you need to use the high BP reversal method, which works all through your system, your mind, your body, and you actually try to heal your body from the inside out. And when you do so, your BP is always going to be less than 140 over 90, and you're going to start to need less drugs, and your doctor is going to take off your medication. If you love that, let me know in the comments. I hope this has inspired you to say, you know what, I want to check this out. And I'll just link it. It's a free webinar. Go check it out. And if you want to have a conversation after that webinar, send me a message. We can book a call with you between now and the end of the year and talk about how you can get free from high BP first quarter in 2022. I hope this helps you. My name is Pharmacist Chiboma Milichukwu, um, Hypertension Africa, helping you to enjoy your best life in super health. Let me know if you have any questions around what we just shared today. Let me know in the comments. I'll be glad to take them. And thank you so much for watching. And let me know which of these issues have been yours and why it's difficult for you, or if you feel like there are other reasons why it's difficult for you, let me know in the comments and I'll be able to respond to you as well. Thank you so much, and I'll see you around. Bye.